have we learned from the parents and have we learned from everybody. So keep that in your mind when we are into the class. These basic things will give very good results. At least the child will become very safe in the class. You agree with me? Okay. So we come to the presentation on the facial expressions, what we discussed. So in the facial expressions, if you see,
okay.
So first of all, what is communication? Very simple. It's a simply act of sending information from one place to another. Next, please.
1 second.
Then what are non-verbal communication? Where we don't speak anything. What we just did a facial expression. We don't say anything, but we could find that what is happening with the person or with the group. Then there are so many non-verbal communication over here. It's a body language of speech. How a body, what is my body language? So for example, I am coming in the class like this. Are you interested? Teacher is having her own time. I'm not interested. Now I in the class I am coming like this. Any difference? Yes. Okay. And what time I am coming super energetic. So that means somebody is going to get flashed today. Right? So these are the various type of expression which is important when you are in the class and when you are teaching your students. In non-verbal communication, there are three important things. Your appearance, your body language, and your sound. Your body language says how interested you are. So if a patient comes to a hospital, okay, and there is a patient and there is a manager, healthcare manager. Now healthcare manager, so who will become patient? We'll do in demonstration. Who will become a patient? One volunteer. I need one volunteer. No volunteers? No? Yes, you. So, I am a manager. And we are doing one role play, okay? I am a manager and he has come to me for some problem. You identify your problem and you have come to me. What happened? Go sit there. Spreading disease. Go. Again. What happened? Oh, don't worry. Sit. Be comfortable. Is there anyone with you from the family? Okay. Third expression. Do you understand? You have to teach like this. Create your classroom with such scenarios. And this is what industry wants. If a student wants to go for apprenticeship, the employee does not want students to know very good English and lot of economics, finance, marketing management. No. He just wants these small things which will help this hospital grow. You agree with me? Yes. This is why this topic is important. So sound also, the body language and the appearance. So just without saying anything, he could identify whether I am helping or I am not helping. Right? And always remember, in the hospital, nobody comes for a leisure. When we go to a hotel, we go for enjoyment. Okay, I have to wait for 1 hour. No problem. I will sit. I will enjoy the coffee and wait. But in the hospital, can somebody wait if they have come? They have not come in the hospital for recreation. So we need a team of the people who are there to help always, immediately. Right? So this is also important. The crossed arms and the clasp behind back. This crossed arm is a negative body language. When you are sitting like this, means you have closed your arms. You are not open. So this is how you are also always open. So don't cross your arms, because the moment you cross the arms, you say by your body language that you are not interested to help anything. This is the gesture. Clasp hand behind. This indicates confidence and authoritative behavior. Yes. Right? Touching or slightly rubbing nose. It means rejection, doubt. Like always like this. That means there is a doubt. Or there is a line. You can find these from your students also. Finger tapping. So you are always, tapping. I'm doing something, but I'm always tapping. So that means I am impatient. I'm not interested. I'm very, very impatient. Don't have any patience. Sitting with ankles crossed. Signal associated with insecurity. Biting the nails is a proof of insecurity and nervousness. Covering the mouth. So this gesture is used to hide emotional reactions such as frown or a smile. Like this. And then stroking to the chin. This indicates person is trying to make a decision. So many expressions are there, which you did just now. Now, recognition learning by feedback. Classical example of learning by feedback. Young children look at their parents and learn from their facial expression what is right and what is wrong. So, have you understood this ever? A child cannot understand the language, but he can find whether you are happy, whether you are sad, and he will behave in the same way. Right? So, this is a huge power which you all as a trainer has to imbibe in it to do best with your students. Although human beings can voluntarily adopt a facial expression, most of our expressions are involuntary in nature. When you know in your conscience that you have to make a particular facial expression, you will make. But otherwise, facial expressions are involuntary. You getting a trophy, whatever happens in your behind, you are not bothered, you are happy. But if your friend gets a trophy and you don't get, then the facial expressions are most of the time are involuntary. Right? It will automatically come on your face. Right? If you are going on a road, if you are going for a very good thing and suddenly a temple comes in the way, you feel happy? You feel happy? Right? So these are the involuntary. You don't know what is going to happen, but it comes automatically. It comes sudden. Expression on a face is the most basic form of non-verbal communication. Our impression of other people is highly dependent on their expression. How he will behave with me. If I am rude to you, he will also be rude to me. What I will do, what I will get. Right? If I am not a good teacher, I cannot make all of you come together and do the activity. I am really happy today that I had an intent that we try to give to each one of you. And I just gave an idea, and everybody has worked together. A very good thing. Because you were together, and that is my job to bring all of you together. Right? So that is what I do, that is what I get. Now, classes of expression. So they are happy, sad, disgust, fear, anger, surprise, or a neutral. Goal is to classify unknown expression into one of these classes. Okay. So broadly, person could be happy or sad or disgust or fearful, angry, surprised, or neutral. So this we did. So there's a lot of expressions. See, one is the ease, happy, laughter, anger, hate, aggressive, sad, bored, mind. And these are the things which we see in our classroom. Relate this with your student. If they are not happy, they are not interested, they will not listen whatever you do. So this is a confusion kind of expression. This is angry kind of expression. This is surprise. How many of you have seen the show Mr. Beans? Okay. Now what is good in that? He never say even a single word. Yes. But we enjoy it. Yes. And we could understand what he is doing. Yes. Right? Whether he is interested in doing the thing, he is not interested in doing everything we can find. Similarly, in our students also we can find. Are they interested to go and work with the employer? Are they interested to work in the healthcare industry or not? When you are counseling the student, speak to them, give them a career counseling, and then ask them, are they interested or not? Just not for the sake of admission. Maybe you will have 10 students in the classroom, but these 10 students will become very good once they complete it because they are interested to go for this. Okay? So this is about the facial expression. Then shame. Again, so this is one of another expression. Fear, sadness, happiness, disgust, boredom, embarrassment. So these are some of the facial expressions. So I hope it was clear to everybody. Yes. Now can somebody summarize why expressions are important for BBA healthcare management?
They have to understand patient is the area of communication.
Right. If they don't understand this, they are not fit to work with the hospital. Okay. So we discussed some of the topics yesterday. So I will quickly take you all to the semesters and give you the overview of each topic. Please listen it nicely, and if you want, you can make notes. Detailed syllabus will also come to you so that you can refer it. So first one is healthcare management and hospital environment. Though we have given the topics, I will quickly take you all through this detail. So here, the objective is to make the student understand about healthcare sector and the hospital sector. So you can talk about different type of healthcare sector. Primary health center, community health center, tertiary health center, diagnostic labs, insurance, medical ambulance coordination, then call center in medicine, telehealth. There are so many kind of things where a manager could work. But you have to explain that system in our country. That gives a career avenue. So don't prepare your student only for hospitals. Getting me? Okay? So don't prepare your student only and only for hospitals. See where all healthcare is related. And as a manager, you should work in all different kinds of facilities. So there it is important to understand about the environment, internal and external environment scanning, economic environment, competitive environment, natural environment, political legal environment, socio-cultural environment, international and ecological environment. So it is about different kind of infrastructure, different kind of requirement, different types of environment for the healthcare industry. Then it is important to understand the evolution of healthcare systems. For example, medical service, surgical service, operating theatre, ops, gynae, neurology service, etc. Then overview of healthcare sector here, where you can talk about, which I discussed, is about different type of places, and also teaching about different kind of people who work in the hospital. You need to know that there are doctors, there are nurses, there are technicians, There are non-clerical staff, there are clerical staff, there are non-clinical staff, there is clinical staff. What all kind of people are there in the hospital? There are patients. So just think that if you teach your subject in the classroom, you are preparing the student ultimately for some kind of job, right? So at least we need to know that in the job, what all kind of people I have to interact with, and who does what. What doctor will do, what nurse will do, what technician will do, what I will do, right? So when I am here in the classroom, I know that you all are students. For me, you are here to learn. That sir, with the laptop, he will help me with the projection. The management is here to help with the lunch and tea arrangement. And there is a lady, she is helping with the serving on the table. I have a clarity. Who will do what? So the manager also need to know what he will do and what others will do for the better work. Okay, if I don't do anything, then I will be running behind. Okay, I have the presentation, who will do? Oh, people want to have tea, who will give tea? Where is the water? Where is the food? I'm not interested, I'm not bothered for it. Because I have a dedicated people who are assigned to do this job and I know it who is doing it. You agree with me? Then healthcare regulation. What is regulation? So for example, the student need to know what is World Health Organization. Why we need to know World Health Organization? Because if he is working in the hospital, he should know that World Health Organization gives the world level guidelines. And so many training programs which a manager could also do. He should also know about accreditation, like NABH accreditation. You go to NABH hospital, which hospital do you go? Okay, which hospital do you go when you are here? Any one two hospitals, give me the name.
Any corporate hospital or any nearby clinics.
Nearby clinics or corporate hospital. So when you go to a corporate hospital, do you see which kind of hospital it is? Or you simply go? You simply go. So if you will see which one to go. Now in Hyderabad, which are the top 5 hospitals? Yashoda Hospital, Care Hospital. Why they are top 5? Their services are. Who said their services are good? People. How people got to know their services are good? The way they receive the matters, the way they receive the patients is like interactive. Have you ever realized what they are doing and what others are not doing, and why this happens? So every hospital, as a university, as a college, you go for NAC accreditation. Yes. You know NAC? Yes. Why NAC is important and it makes you different from other colleges? Yes. Similarly, in hospitals, there are accreditation. NABH accreditation, National Accreditation Board for Hospitals and Healthcare Providers. For lab, there are NABH. Now, these NABH, when any hospital applies for this accreditation, the NABH have hundreds of documents and hundreds of processes which the hospital have to follow. Because NABH aim is for the best patient care. For delivering the best patient care, everybody in the hospital has to work accordingly. So the managers are going to help in the accreditation. Right? But if they are not aware in the college that what is NABH, what is WHO, they cannot relate it. They don't know. Then what will happen? Then epidemiology, don't go into the details, just a paragraph only. So if they are talking about epidemiology, they just need to know what is epidemiology. They don't need to go into the nitty-gritty of epidemiology. For all these topics, just keep a paragraph. That's all. Basic means very, very basic. In epidemiology, there will be 5 books which a student will read. No use. No paper will come from that epidemiology, from our side. Our questions will be very, very simple. Okay? So, just keep a paragraph on these topics. Then Then human biology and medical technology. This we discussed yesterday. So avoid using jargons, and the student also need to know few jargons. Jargons means medical language. What is pathology? What is gynecology? What is operation theatre? What is Ayush? You know what is Ayush?
Yes, Ayurveda.
Ayurveda yoga. These BBA healthcare managers also work with the Ayush hospital. Right? So you can talk about these into here. You can also talk about different kind of diseases, especially infection control diseases like corona. So basic, like what he has to do to protect himself first, and then he can help others. So if a manager, he is a manager and he is not taking care of himself, is not wearing mask, is not wearing gown, then he cannot, prevent himself from the disease, and from him it will spread into his family also. So the basic kind of infection and how infection could be break. So this is how we can complete this particular topic. Now in the organization and management process, it is about the basic management. How you manage your work, how you divide your work, how you prioritize your work. How could you know that which work is important at what time? So don't go, again and again saying, don't go into much deeper details. Just give them a brief orientation that they know the basics. That's all. Decision making. So give scenario. So if there is a patient and he is not able to sit, so manager has to take a quick decision. He cannot make him wait because his policy says, okay, you have to fill the form, sign the document, then only we can take him for the treatment. So those type of scenarios you give to the students. Don't give them reading material. It will not help. What will help is the case-based scenario. Otherwise, there will be a totally mismatch. Getting me? Don't burden them with lot of reading material. Because they will read that material just to pass. We don't want to make them pass. We want them to know what is in this. And they will only, and the question paper is also like this. Our question paper will not come based on all these details. It will very very to the point. And we will also give some sample question paper. Okay? Then directing, redirecting, leadership. What do you mean by leadership? What is leadership?
Managing people.
Managing people.
Giving direction to them.
To manage all type of aspects.
Giving direction to them.
Giving direction.
Leader is a person who guides his team.
He is the guide, right?
Only need to give it.
Right. So for the leader, there is always an objective in his mind which he has to fulfill. Now to meet that objective, he has to identify various resources, and then he has to delegate the responsibility to each of the resources. And he also need to check whether those tasks which he has given to the team is met or not. And ultimately, he has to ensure that the objective is met, and he also has to ensure the time frame. Understood? Okay. So when you are going in your class, you are a leader. Now, as a leader, what is your responsibility?
The directions.
Okay, you are going into the class as a leader. What is your objective? Why you are from the
We make them understand the topic.
to make the class silence? Okay.
We make them understand management or managing the student.
Managing the student.
Making them to understand your
Okay. Any other?
Leader is given in
the rapport between the students and
Rapport. Okay.
it must be like interactive discussion.
Interactive. Whatever all you said, this is not the objective.
creation of the problems.
The objective is, as a teacher, when you are going to the classroom, the objective is the student should be able to understand what you are teaching to the student. That is the objective. and the student should be able to clear the exam or get the job. That is our goal. Now, in order to fulfill that objective, you have to ensure that the classroom is silent, there is a rapport building, students are listening, my content is ready, I have approvals from the process. Getting me? Got the understanding what is objective? Your objective should be very clear. If your objective is clear, then only you will be able to lead your class. So as a teacher of BBA Healthcare Management, your objective should be that my students should get good employment opportunity. Whether anybody will help or not help. Whether HSSC will help with the apprenticeship internship or not help. I will train my student in a way that hospital will come and we would like to hire him. For BBA Healthcare Management, for the student, the basic requirement of the employer is that person should be able to speak and understand basic English. He is smart, he dresses well, and he knows basic computer. That is the basic. If he knows this only, he will get 15,000. But if he also know about healthcare, that is, he will get 25,000. At least you can prepare him for 15,000.
Yes.
Can you do that? No confidence, I would say.
Yes.
Still no confidence.
Yes. Yes.
Still no confidence.
Yes. We can do it.
At least you can prepare him for this 15,000. Right? Take that ownership. Because you are going to change the life of the student. They are coming from very poor background. 15,000 will mean a lot to him. If no help, still my student will get some employment. He can do something to live his livelihood. At least I can make him employable. Okay. So, very, very important when you are teaching your student, keep this objective in your mind. Your objective should be very, very clear, and then only you are going to delegate all these things. Boring? Boring. Okay. So this is about that, what comes into the management and the business. Business is not about you have to make them Tata Birla. No, they cannot be Tata Birla in BBA Healthcare Management. They cannot become Ambani. So it's about that what basic they need to do. You have to make them employable. Employable means, what are the employability skills? Okay. How a person becomes employable?
Good communication.
Good communication skills, okay.
Good understanding.
Good understanding.
Listening.
Only one topper in the class. Madam, what's your name? Ramya ma'am is the topper. Nobody knows other than her. Commitment. Okay. Sorry? Talking, okay. What else?
Listening abilities.
Listening abilities, okay. Simplicity. Okay. Fast.
Coordination.
Coordination, okay. Understanding. Innovative thinking. Truth.
Efficiency at work.
Efficiency at work. There are 3-4 more skills. Discipline. Discipline. One is digital knowledge. Today, how many of you have smartphones? So, the person needs to know digital. He should know basic computer. He should know basic apps. At least he should know CV and Zomato. Agree with me?
Yes.
Okay? So that is basic employable skill. So if a patient has come, he is not able to know where to get the taxi cab, at least he can book a cab for him. Second is financial literacy. What is financial literacy?
To understand the financial terms. Where to invest, where not to
So
invest.
what are the changes which has come in the finance now? Today, you get your salary in your account. If you want to purchase something, you can pay that Paytm. Use Paytm. How many of you? Online transactions. No need to go to banks now. No need to go to ATMs now.
Paperless transaction.
Paperless. Okay. Now tell me, how many of you when entered into their first job? First job. How did you get your salary? First job, how did you got your salary?
Cash in check.
Cash in hand.
Okay, check.
Check. Okay. Then account.
It is cash in hand, check, account, online transaction.
Online. And then, did you get your payslip? Do you know when did you got to know that there is something called payslip also?
Yes,
Which year? Before salary getting? Before job, or you already knew that there is a payslip also?
we are aware of payslip.
Okay. So commerce people leave commerce.
Payslip will be there, but when we require, we come to the office, especially when we take the loan.
No, I'm asking when you got an awareness that payslip is also something. When?
That's the employment when we get all the details.
Yes.
Okay. How much
And
we are
then
getting,
looking at the payslip.
what benefits we are getting, details, and then like you know, now we have your payslip.
Payslip. Then how many of you knew before going into the job about PF? Not the commerce people. PF.
During the time from
From the employment you got to know about PF. How many of you got to know about tax? Not the commerce.
our jobs are not available to be paid with
Tax. But you knew something is tax is there. You know something is there as tax. Now you are in the working. For so many years you are working and you are well known with this term. But the student doesn't know. If he goes into a job, employer will say, I will give you 20,000. But in his account he gets 12,000. Now he is fighting with the employer. Why? You said 20, you give me 12. Now employer will be having a headache explaining him what went into the PF, what went into the ESI, what went into the HRA, what went into the allowances. You understanding what I am trying to say? So you have to teach your student about employability. Employability means what all is there in the employment. So if employer say you will get 20,000, will you get in account 20,000 directly? There will be deductions. Right? So he should know about such things before he goes for the employment. Agree with me?
Yes.
So you have to teach employability skills to the student, how he will become employable. Then in hospital operations management, it is about the role, the functions of hospital front desk coordinator, functions of patient relation associate, duty manager and other people in the hospital. Then what is the process of admission, billing, medical record, ambulatory care, or death in the hospital, fraud and debt, maintenance, and so many things are there. Then about the support services. So in a hospital there are support services. What all kinds of support services are there in the hospital?
Wheelchair.
Transport, wheelchair. Then
Emergency services like
not the clinical, I'm saying support services.
IRS and also
Okay.
nursing or IRS.
There is a laundry service.
Yes.
There is a food service.
Yes.
So they all are the. So as a manager, they can also work to head the department of laundry, of kitchen. There are so many things we can do. So linen, bedsheet. So many bedsheets are there in the hospital. So there's a lot of business which comes there. So the location, what kind of location, what kind of type of a hospital. So in the facility location and layout, give a task to your student to prepare charts and model of a hospital structure. So they will research that what all kind of departments are there, which department do what. Right? And for example, the lift It's always there with the operation theatre. You know why? Why lift is always with the operation
That is,
theatre?
for patients it will be different, and for doctors it will be different, and for common people it will be different.
The very important reason is whosoever is going for operation, he will not, most of the time, he will not go on the foot. He will go in the stretcher. And if he is going on the stretcher, the lift should be just near to the operation. So that's a layout plan. So give your student homework to read about these things and come prepared. Rather, the student, himself is dependent on you. So use the technology. Give them YouTube videos. Give them our LMS where they can find all these resources. Your job will be easy. So don't teach them thesis. Don't make them researchers. Getting me? Then purchasing strategy. So if for a hospital he has to purchase something, there is a process of approval. So he needs to know that what all kind of processes are there in the hospital. Then in the patient behavior and care. Patient behavior is about the different type of patients, different type of behavior if we discuss in the morning. So those kind of role play, those kind of activities you can do in the patient behavior. Getting me?
Yes.
Similarly, patient care, hospital administration, and legal responsibility. So, if as a manager, he has some job which he has to do, and some job which he should not do. So, as a manager, can he give injection to a patient? Can he do operation? Can he give medicine? Can he give physiotherapy? So he needs to know that what he should do, what he should not do. If we do something, the responsibility is of the hospital and we will be removed from the job. Right? So only the licensed people can take care of the patient. Whether the doctor or nurses. Rest other people will help doctor and nurses for the better functioning of the system. Then in the management information system, it is about the data entry. So today when you go to a hospital, how manager or how admission specialist take your details? How? They give you a form, you fill, and those details they put into the system. So he should know the data entry. So do you have computer labs in your college?
Yes.
So give every week 3 hours in the computer lab. Give them typing work. I am giving you those skills which is very important for employment. Give them typing work. Give them data entry skills. Include that as a part of your curriculum. Instead, you teach them. Give them basic formulas. Addition, subtraction, division, average. Right? Give them, in a week, 3 hours computer, 1 hour for data entry, 1 hour to do formulas, and 1 hour to just look at the YouTube and find different type of healthcare manager related videos. Internet surf. Give this a week, 3 hours. 100% your students will get job. You agree with me?
Yes.
Right? Instead, you teach them management information system and give them all theory, not theory. For the curriculum, you have to write everything because you need something to get it approved on the paper. But as a practical, you have to find innovative things to teach them. You teach them about telemedicine. You know what is telemedicine? What is telemedicine? Okay, what do you mean by tele?
Telemedicine is like we can approach the doctors online.
You can approach to a doctor online.
Like practical.
Yes. So teach them about telehealth. That is telemedicine. In telehealth also managers are needed. You can at the back end is supporting bringing doctor and patient together. So that's a telemedicine. And a demo of a hospital, you can get it prepared from your students. Then in communication and report writing, just to do demonstration through role play in the class. Okay. So this is very important. If you do demonstration with role play, your student will be able to understand much better than compared to any other. Also prepare them to write the application form, write the letters, write the minutes of the meeting. Okay, what is minutes of the meeting? Whatever we have discussed in the meeting and the agenda. Have you ever told about this to your students? Yes, ma'am. BBA healthcare management student? In our commerce auditing. So you have to bring all these things into your employment. So if a manager, BBA healthcare manager, he is in the hospital and he is a part because every day there is a meeting happens for managers. It's like before they come at the job, before and after. Before, just to understand, is there any policy change? Is there new things have come up? New package has come in the hospital? New kind of referral things has come up in the hospital? How many patients are there? So in the hospital, we say over. Over giving, over taking. You know, right? So the managers are part of this over process. They need to note it down. What were the key discussions? What were the decisions taken? What was the date? Who was there in the meeting? Otherwise, tomorrow if we do something and the management deny, no, who said this? I don't know. Why did you do this? Why did you do this out of the patient? Why you pay out of your pocket? At least this poor child is having the same minutes of meeting. Right? So give this type of skills to the patient. Okay? Now, so if I look at this, so we have completed things in the semester wise. So now you are clear about healthcare and hospital environment? Yes or no? Human biology and medical technology? Now clear what needs to be given to the student? Organization and management process? Any doubt there? Organization and management process. You have to give them different type of hierarchy, different type of people, roles and responsibility, who will do what. Hospital operations management. So again, different type of facilities and what is the layout of the plan, how things has to happen in the hospital. Patient behavior and care. Yes, no? Yes. Management information system. Data entry, data checklist, communication and report writing. Yes. Customer service excellence and patient satisfaction. How we will ensure customer service excellence? So, yes, the communication. Healthcare and insurance. We discussed insurance yesterday. We need to know what are if a patient comes and I have an ESI. We need to know what is ESI. Yes, that is Employees Insurance Corporation. You need to know what are the ESI benefits. If patient comes with saying I have an insurance policy, you should know that whether this insurance is listed in your hospital or not. If it comes with a government insurance, those legal and ethical issues. Risk of a manager, the rights and responsibility of a manager, the rights and responsibility of a patient, the rights and responsibility of a hospital. You should know well versed with these three things. Then office management software, Excel sheets, Word, presentation, minutes, how to manage it. Quality management in hospitals, accreditation, We need to know what is NABH, what are their policy, what are their standards, what is the quality process, how you ensure the work is done in a proper way. Right?
Right.
Risk and disaster management.
Right.
Risk and disaster management. What is disaster?
If any accident occurs in the
Management, right? So in a hospital also such kind of risk and disaster happens. Fire is there. So give the scenario to your student. How he will work. The theft has happened. All these things don't go to the doctor, it will come to the manager. Yes. Somebody has abducted the child from the hospital. There is a medical legal case. So a woman has come with some kind of abuse in the hospital. Now as a manager, he has to inform the police first. He has to ensure that the evidence are not tempered. So they all are under medical legal. Just Google basic medical legal case in the hospital. You talk it to your student to prepare and come prepared. Right? Then biostatistics, don't make them researchers. Just like paragraph. Marketing management, financial management. We discussed yesterday about the camps. Those things will come here. Hospitals and pharmaceutical management. It's about pharmacy, how medicines come from pharmacy, hospital planning, management control, supply chain, and human resource management. So this is all what is there in your curriculum for entire BBA. Now you have thorough knowledge what is there in BBA healthcare management.
Yes.
Now do you find it difficult or easy to teach? It's easy or difficult? Now it's not easy, but now you know how to teach it, how to deliver it, how to find the right information, how to make them employ. Right? Now we will quickly do one exercise. All of you please start. Now you know yoga which can be done standing in a proper position for relaxation. Okay, so can one demonstrator come here? Maybe all will come. Who will come? You know Tadasana?
Ma'am, can you please?
I do, okay. So this is Tadasana. So just you stand on your toes. All of you have to do it. Do, go as much as you can. Do, all of you have to do. Now can you do like this? Just move your feet. Some people are sleeping, so I think now do clockwise, anti-clockwise. I am a difficult teacher. Do like this. Move your shoulders like this. Clockwise, anti-clockwise. Rest like this. Move clockwise, anti-clockwise. Rest like this. Do it. Put your palms. Keep it on your eyes. Yes. Feeling good? The one who was sleeping, he or she will get to know. Can we have another presentation, sir? Can we put the pies model?
Madam, the type of BBA admission, when after this is what made the party, and we discuss therefore, the time of idea, 3 months, I don't know,
I don't know that what is the
friends are always seeing.
they will be asking for.
Why? Because 5 years they are forced to training in hospital. Because experts are in training.
Then they will go for apprenticeship last 6 months they will get. But not before.
That is where the space
But you can check with the result.
oh.
You can go with the employer for 6 months and then do. Now, what is PIES? Have you heard PIES? PIES model. PIES model. P for psychology, I for intelligence, E for emotions, S for security. This is PIES model. Building a safe spaces in classroom, exploring the PIES. Next slide, please. What does it mean safe? When you feel safe, when you are safe. Give me examples. When you are safe. How do you think that you are safe?
Perfect health.
When you have a support, when you have a help, okay?
No economic problems.
No economical problem.
And when we are under the shelter of elders.
And they are okay, right?
Smooth atmosphere in family.
Okay. Yeah, right. You are right.
Why? Because always the teacher is facing the problem in home.
Right.
Do not have service in place.
Right. So the peace at home is very, very, very important.
Getting the survey is
On time.
Right.
That is also
Very,
very
very important to have a peace in life.
Right. What else?
related to teachers.
Okay. So what does it mean safe textile?
Opposite is
Next. In a classroom environment, when do students feel safe? There's so many things. Next. Can you see this picture? This picture from the newspaper. What is happening in this picture?
The students are writing their examination.
Examination and innovative way so that student does not teach and cheat. Does not copy. Do you think it's a right way of doing it?
No.
So
means just also.
they are not safe. Okay, next. This is a real picture that happened in the school. Next. Now, here what is happening in these two pictures? They are enjoying, and the other picture?
They are representing man.
They are representing, okay.
Pictures.
Next picture?
No, and they are representing the pictures. Rock, hard,
There are two different pictures.
hard and softer.
No, there are two different pictures. Both pictures says different story.
And they are enjoying.
They are enjoying, okay.
Even though they have great personality, they are together.
Okay.
And here they are reflecting what the pictures.
Dominated is your.
Just think something different looking at this books.
Happy. These are opposites. Opposite. Yeah, opposite. Here they are enjoying. Here comparing.
Okay. Now, this is who is he?
He should be.
Chota Bhim. So when we were small in our classroom, anybody said us mota hai, patla hai, hathi hai.
Body shaping.
What is that? Body shape.
Body shaping.
The Chota Bhim. He is a boy, but he is called Chota Bhim. Bhim means huge body. It leads to a body shape. You agree with me? Yes. In a classroom, you may or other children may say out of a fun, but the one who is affected will have it lifelong. Right? Then any of you give any one example which has happened in your childhood? Okay, so I will tell you. When I was in my school, I was always said that I am very arrogant. I was an arrogant girl in our school. I am sharing my story so that you can share your story. So I was told that I am very arrogant girl in the school by all my classmates. And when I become elder, more, elder, then I myself, when I speak to myself, I always say, yes, I am arrogant. Yes, I am arrogant. Yes, I am arrogant. Because I started taking it like that I am arrogant in my life. Then one day, my mother said that, who said you are arrogant? You are not arrogant. You only speak less. You only speak to the people with whom you know. You don't open to everybody. That doesn't mean that you are arrogant. You are little introvert. You're not extrovert.
This arrogant when you are giving an answer to a opposite person, the behavior is reflecting that you are answering in an arrogant way.
Yes. So this is what you are perceiving. The other people may perceive, okay, she doesn't speak to us.
She don't mingle with anybody.
I don't mingle with anybody.
She's a calm girl.
She's a calm. So
She won't involve.
yes. So she will not involve because she is arrogant. Or she is proud of something in herself.
Yeah, she's
So
she's
she-
only having a knowledge of everything.
Yes. So she is not, mingling with us. That means that she is not interested to spend time with us.
Okay.
So for my entire childhood, I thought to myself, yes, I am arrogant. But then I realized that I am not arrogant. I am open also, but to the people who are living. Then there was a boy in our classroom. He was always said, Kala Bandar. It's Kala Bandar. And we all used to have lot of fun around it. But is it right? Because in his memories, he always had that feeling. So we don't have to do body shaming. We don't encourage doing body shaming. Your child, your classroom students will never be safe. Because every time they will feel, oh, somebody is projecting to us. So somebody is, she is making fun of me. So I will not open it. Now in that picture, one is beautiful, one is ugly. Do you feel anything ugly like anything exists on this earth? Everyone is created by God. Everyone is beautiful. But in our books, we show one is beautiful, one is ugly. How can you define beauty? Can somebody define beauty?
At the heart, emotional.
So just looking at the face, you cannot be beautiful. You have to be beautiful from your heart. And when everything is created by the God, then how can we question to the Creator? Just let me pick this one. And when he comes from school, the first thing he has to call me. And he is having a good news that he selected for the race, state level. So the first thing he has to tell. Now, as a mother, wherever I am, I have to first listen to him. Because for it's a prestigious moment. He's not bothered what I'm doing. Right? So that is how we have to deal with our children. And the same way we have to deal with the children who have come to our class. Thank you. Right? So personally, as a teacher, I always ask my teachers wherever I am going, don't define like this. Everyone is beautiful. Everyone has their own problems. Everybody has their own struggles. Maybe I am not good in doing one thing, other person is doing better. But I may be better in other things which other person may not be doing. So why we have to compare? Right? We have to identify who is doing what and where we all can come together and do the work. Agree? Not agree? Agree? So we always say, we recommend that we should not come with such kind of thing in our classroom. Next. So if you look at this, social, cultural, political, economic factors take away safety of young people. So economic class. I don't have money that I can go to McD and have a burger. My friends are going and I am feeling very shy. No, that should not be. Why we are discriminating? Basis on the economic class? We are discriminating basis on the gender. Oh, she is a female, she cannot do this. She cannot lift the table because she is a female. She is very soft. Why? Oh, he is a man, he cannot cook. Why? How many men cook food? Good. What others? Your husband. Okay. How many men bring vegetables from the market? How many females go and bring vegetables from the market? Right? So there is nothing like, this set of people will do this set of people will do this. Everybody can do everything. There are certain biological processes which God has created. And we respect that. But that in any way is not making you incompetent to do certain things. Right? So, by the biology, by the processes, the body is created in a different way to meet the different requirements. So, in your classroom, so I'm trying to relate everything with your BBA lecture. In your classroom, if you have boys, if you have girls, so the boys always say that I am not made for hospitals. Why will I take care of the patient? This is the work of a female, of taking care. Is that right, wrong? No. Right? Similarly, the girls will say, oh, I will study, then I will get married because I am not allowed to work. Then why you are studying? You want to be a good manager at house. Maybe. So you have to find different ways to work with your children in the classroom, that there is nothing which divides you based on the gender. So the females will say, okay, I will not work for the night shift. So in the night, patient goes back to the home. Is that happens? No. So you have to break this barrier. This I will do, this I will not do, this will not work with healthcare. But one promise is there from healthcare. If you want to work, you will never sit without job. You will always have a job. Because patients are increasing day by day, hospitals are increasing day by day. Corona came, everybody was shut, but hospitals were growing, increasing, doing 100 times. Right? So hospitals we cannot change. So it will always there, employment will always there. You have to break this. Then age. At this age I can do this. Definitely there are some physical kind of issues which happens with the age. But with that age, your other things grow. For example, if I am at the age of 30 now, 33, 34 now, so I have a lot of energy to work around. Maybe at the age of 50, I may not travel that much, but my intellectual will be very strong. I can sit and manage hundreds of things. Today I am managing 50. At the age of 50, I will be able to manage 200 things, 200 projects. Because my intellectual is very strong. With the experience I have gained. So, age is not a barrier. Then sexual orientation. I am a male, I am a female. As a male, I can do this. I am a female, as I can do this. As a female, I cannot go in front of the patient. They will watch me like anything. As a male, I am not feeling secure because all the female nurses are around. This will not do. Then education, media, and the caste. These are the things which affect styles of your student. Psychological, intellectual, emotional, and social. Till the time this is done, the child will have a safe environment. So, next. So, this is physical safety. You have to ensure physical safety, intellectual safety, emotional safety, and the social safety of the children in the class. So, in the physical safety, don't give any physical hitting or punishment, corporal punishment. Don't give. Then your bad body language, voice tone, and choice of words. Sometimes what happens in the classroom? Yes. Sometimes what happens in the classroom? Some children will say, "Oh, ma'am is very good to you, but she's not good to me." You have not done anything bad to her or him, but still they have this problem. Why? Because your body language is different with one child and different with other child. Right? So, your body language, voice tone, pinpointing somebody or start staring down, you just boring like this. Then take into consideration of all the safety like floor not slippery that they don't fall, risk of falling down, necessary safety precaution, especially in labs. So when they are going to a hospital, you have to ensure that they are safe. Then physical classroom is accessible to a learner with physical disability. So if you have any student with disability, your things should be that you meet their requirement. Next. Next. Now if you see next. So here what is happening? Everybody is sitting in a circle. So no one is like first benchers intelligent, last benchers bekar. Everybody is sitting in a safe. So from the trainer to the student, the distance is safe for everyone. So the trainer is in between and all the students are sitting comfortably. So in your classroom, not always, but try to arrange different kind of seating arrangements. So everybody will take a part of it. Right? So instead of the traditional row seating arrangement, next. Sitting in a circle brought down all the barriers and made everyone feel equal and heard. Yesterday we did that exercise na, in sitting. You all were equally doing the part of the thing. So how simple physical structure change brings safety. So in this, nobody is having a thought that okay, I am superior or I am not superior, or the first benchers are having good understanding, last benchers are work of nothing. Those feelings are not true. Intellectual safety. Giving time for your learners to avail available study resource independently yet under supervision. To give them work and ask them to present tomorrow. But you are giving them freedom to read. Okay? Trusting the process, respecting the pace of learning. Somebody will take it fast, somebody will take time. Respect that. Everybody doesn't. So, if we all are here, we all know which language? How many languages? We know Hindi, we know English. What else?
And other
Telugu, other tongues also. Other tongues. Now, if today we start with a session in Japanese language, you all have to read Japanese language. How many of you are ready to read that? Only one. Because that's a new language we are going to read. And we all gave up. We cannot do it. Now think of a child who has just come into the class knowing nothing and is ready to read. Now, some will read, understand faster. Some will take time. Respect that. Try different methods to take that subject to the child. Don't impose. No, I can do it in 5 minutes. In my childhood, I did in 10 minutes. Why you are taking 20 minutes? Don't compare. In our childhood, we never had any pressure in our life. Today, children, they are in huge pressure. Multitasking. My 7-year-old child, he is every month giving 3 competitive exams. Olympiads, GPSC, and I did not ask him because his friends were giving, so he is having a peer pressure. No, I have to because I am intelligent. I can learn all those things. I have to do it, mom. I have to do it. No, I cannot say, okay, don't do it. Okay, you try it. And you do. So, but in our childhood, did we had any kind of pressure? No. So, in this class, somebody giving birthday party in Taj Hotel. He also wants to give no less than Taj Hotel birthday party. Right? Because he is having a peer pressure. And he is also having a pressure whether my father will allow her or not. Right? So, there's lot of pressures. Very basic pressure. 3-year-old, I have a 3-year-old daughter also. Now she is wearing diapers and she is going to a play school. She is also in stress because for 6 hours she is in diapers. That's a pressure. We never had that pressure because my mom did not allow me to go to school before 4. You getting me?
Yes.
There's lot of stress with the children. So what we did is not the same what they are doing. Respect that and then deal with your children in the classroom. Then encouraging questions and even disagreements in class. Encourage questions. Encourage. So for example, if you are not agreeing to a point in the classroom, the students are not agreeing, respect that also. Don't impose anything on the children. Understanding diverse learning style, preferred medium, audio, 3, visual, and kinesthetic. Now, educators bring their vulnerable selves in a safe environment. When educators don't act as knowledge source, know it all. So, the educator is going along with the student as a part of a group. Share your personal story of failures, fear, and anxiety. Accept dissent and debate. Encourage critical thinking. Play along and retain your humor. Role model begin being open and vulnerable. Now, emotional safety, saying, I don't know, let's figure it out together. Okay, so as a teacher, if you don't know anything, just say to the student, oh, I also don't know, we will figure it out together. So you're giving an emotional safety because the student will say, oh, teacher is not a god, which is a Google Baba, that he knows everything. He is also like me. That brings an emotional safety. Giving space for the learner to themselves express themselves freely, maintain confidentiality. So if a student comes to you saying, oh ma'am, I have a problem at my home and I'm not able to pay the fees, but we will arrange it next 10 days, don't share it with everybody. Okay? If a learner an emotional breakdown to hold space for them to talk, cry, or walk, talk, understand what happened. So that's the emotional safety. How activities break barriers and patient bring safety. We can design our activities such a way that it gradually builds the safe space for learning. Activity where huge safety is required because of physical closeness and contact of members. Safe environment allows any challenging activity to be engaged in an easy and a fun manner. This is river of life. I will. So social safety, equal participation of learners of different genders, even while they are sitting in the classroom. So don't make it okay. Girls will sit here, boys will sit here. They will sit together. Why create those barriers? Right? Encourage friendships across barrier of gender, caste, class, and religion. You cannot be friends because you are from a different community. Or you cannot be friends because one is rich, one is poor. Don't create. In a classroom, everyone is same, together, equal. When they express themselves, they are heard, supported, and appreciated. Not ridiculing new ideas, thoughts, or questions, but a learner knows it's okay to make mistakes. Very, very important. Socially safe smaller groups. You can have smaller groups also. Connecting dots between power and safety. Intent to assert power, intent to build safety. I have to show as a teacher that I am powerful. What will I do? I will threat, or I will intimidate, or I will isolate, blaming, pinpointing, privileging as a teacher, emotional disregard, no learner agency, and bias. If I am doing any of these things, then I have an intent to assert power. Now, if I have an intent to build safety, then what will I do? I will share responsibility. I have respect for learners. Right? I have fairness. I will be fair with everybody. Non-threatening behavior. Okay, you don't do this, I will do this. Non-threatening behavior. More authentic. I am authentic. I'm not just showing, okay, I have come with a fancy sari, fancy makeup, coming, doing my job and going. I have to be authentic. Trust and support. And this is how I have an intent to build safety. Now, how many of you put yourself in which of the circle? Intent to build safety or intent to assert power? How many for intent to assert power? Raise your hand. How many intend to build safety? The rest are doing nothing. So you have to judge yourself where you want to lead your teaching. Again, this is what we discussed. So all these factors defines the safety of the children in the class. So teachers knows their students. Students are given choices. Students are accepted. Students' needs are addressed individually. Students know their teacher. Students are given voices. Students can be themselves. The classroom is consistent. The classroom norms are clear and positive. Dialogue circles are formed. Teachers are their authentic self. All are happy. The classroom is inviting. Everyone is challenged. Everyone is engaged. We celebrate success and fair. This is what you get if you lead your teaching and training strategy like this. Any questions? Excellent. So we have from the high school. Okay. Now we will go ahead and have the topics which were given by me yesterday to the trainer. They will present their topic here, and we all will listen to them very nicely. And the ones who are presenting, they will also ask questions once they finish their topic. Okay? You will also ask questions to the audience when they finish the topic. Okay? So, Nagesh, you can start.
Formal medical technology, Mr. Srinivas and Mr. Govind.
Okay. You can come here and did you like today's session?
Yes.
It was interesting.
Yes.
Did you feel
Yes.
do you think it is important to add in the teaching training strategies?
Yes.
Because this will just not help for BBA healthcare.
Yes.
It's for the teacher this is important.
Morning, everybody. My topic is observations from medical terminology. So, who are the BBA graduates are contained for minimum knowledge for observations in medical terminology. Yeah, first one, HB, hemoglobin, another HB, heartbeats, CC, cardiac cycle, SV, stroke value, Hg, mercury, TV, tidal value, TVC, tidal value capacity, VDRL, Mineral Disease Research Laboratory, AIDS, acquired immunodeficiency syndrome, HIV, human immunovirus, TB, tuberculosis, TB, typhoid, BMR, biological metabolic rate, OP, outpatient, IP, inpatient, GIT, gastrointestinal tract, ENT, ear, nose, tongue, MRI, magnetic resonance image, ECG, electrocardiogram, EEG, encephalogram, CT, computed tomography, ESR, electrocytics, sedimentation resistance, RBC counting, red blood cells counting,